The first test item cluster is for mechanical neck pain that will benefit from thoracic manipulation. There are 6 tests that make up this cluster. They are symptoms less than 60 days, no symptoms distal to the shoulder, a fear avoidance belief questionnaire of less than 12, looking up doesn't aggravate the patient's symptoms, there is diminished upper T-spine kyphosis, and cervical extension of less than 30 degrees. I'll have you look up for me. Does that bother you? No. All right, look back down. Okay, and then look up for me one more time. Okay, very good. The second test item cluster is for full thickness rotator cuff tear and subacromial impingement. There are 4 tests that make up this cluster. The first test is the painful arc. This test is used when either a tear or impingement is suspected. Any pain is a positive test. Pain between 45 and 120 degrees is more closely related to impingement. I'm going to have you take your arm from your side and reach all the way up to your head. Very good. Another test used when both a tear and impingement are suspected is the infraspinatus muscle test. The test is positive if the patient has pain or is unable to resist medial rotation. I'm going to have you hold your arm like this. I'm going to push into your belly. Don't let me move you, okay? Ready? Very good. The third test in this cluster is the drop arm test. It is used when a rotator cuff tear is suspected. A positive test is indicated if the patient is unable to return the arm to the side slowly or has severe pain indicating a rotator cuff tear. All right, I'm going to pull your arm up here. Now I want you to slowly bring your arm back down to your side in the same way I just brought it up, okay? Very good. The last test in this cluster is the Hawkins-Kennedy test for impingement. It is used when impingement is suspected. So, I'm going to have you hold your arm down like this. In front of me a little bit. There we go. Okay. Ready? Ow. Very good. The test item cluster for mechanical neck pain that would benefit from cervical manipulation is made up of 4 tests. The first being symptoms lasting less than 38 days. The second is the expectation that manipulation will help. The third is PA testing of the mid-cervical spine. It's used to determine pain, mobility, and infield. The test is positive if the PA force provokes pain. You look down for me, okay? I'm just going to push down. The last test is cervical range of motion. If the left and right cervical range of motion differ by 10 or more degrees, the test is positive. Alright, just look straight ahead for me. Okay, now look over your left shoulder. Okay, now look back straight. Now this time I'm going to have you look over your right shoulder. Alright, very good. Upper limb tension test for the median nerve. If there is greater than 10 degrees difference in elbow extension between the symptomatic and non-symptomatic arm, the test is positive. Right? The second test is the distraction test. A positive test is the alleviation of the symptoms. The third test in this cluster is the Sperling test. If this test reproduces the patient's pain or arm symptoms, it is positive. All right. We're going to take your left ear towards your shoulder for me. Very good. The fourth and final test in this cluster is cervical rotation. If the patient has less than 60 degrees of ipsilateral cervical rotation, the test is positive. Okay, I'm going to have you take your nose and turn towards me. Very good. The upper limb tension test to test the radial nerve, tests the length of the radial nerve. If this test reproduces the patient's symptoms, it is considered positive. If you flex your fingers and your thumb for me, bring your shoulder out a little bit. Okay. And across your shoulder, to your elbow. Any symptoms? Alright, so very good. In order to differentiate between a rotator cuff tear and a C5, C6 radiculopathy, I need to assess the C5, C6 dermatomes and myotomes. A tear or impingement wouldn't disrupt the neural structures, unlike a C5, C6 radiculopathy. Flex your elbow, relax. Very good. The knee impingement test is used to determine if there is an overuse injury to the supraspinatus muscle or the biceps tendon. The test is considered positive if the patient indicates pain with the test. Let's medially rotate your shoulder here. Okay, just relax. I'm going to move it. Very good. The moving valgus stress test is used to determine if there is a medial collateral ligament tear. The test is considered positive if there is pain between 70 degrees and 120 degrees of extension. Okay. Up here. Fully flex for me. Very good. And the sharp pursor test is used to determine subluxation of the atlas on the axis. If the transverse ligament is disrupted, C1 will translate forward on C2 with flexion. A positive test is indicated if the head is felt to slide backward on movement. All right, I'm going to have you take your chin down towards your chest just a little bit. There we go. There we go. Two, here, okay. And I'm going to push back. Just relax. Very good. The active compression test of O'Brien. This test is designed to detect SLAP lesions or superior labral lesions. If pain on the joint line or painful clicking is produced inside the shoulder in the first part of the test and eliminated or decreased in the second part, the test is considered positive for labral abnormalities. I'm going to have you put your hand out with your thumb down. Okay? Push this over right here. I'm going to apply some pressure. Okay? Any pain with that? Hold it. All right. Then we're going to have you hold your hand up. Hold it. Same thing. Have you hold it right there. I'm going to push down. Okay? Pain with that?